You just rolled your ankle or you tweaked your low back. Should you run to the freezer and grab an ice pack to decrease the inflammation? Let's dive in. Hi everyone, Floyd Meyer here. I am a physician assistant and I have a master's in public health. I'm currently working in an integrative physical medicine and rehabilitation clinic. The most common question that I get asked in practice is, should I be using ice or heat for my injuries? So I decided to take a deep dive into the scientific literature to make sure that I was providing the most up-to-date information for my patients. Now, injuries can be broken up into two separate types. We have acute injuries and we have chronic injuries. So acute injuries are going to be happening fast. We can think of things like sprains and strains. For example, you roll your ankle or if you tear a muscle. Now, chronic injuries, on the other hand, are going to occur over a much longer time span, and it's going to be things more like that achy low back or that pain in your neck that just will not go away. Most people believe that following some type of an acute injury, like rolling your ankle, you want to decrease the amount of inflammation, which is going to allow your body to heal faster. And the use of ice has become commonplace both in the general public and in the sports medicine world due to the easy to remember acronym RICE, which stands for Rest, Ice, Compression, and Elevation. Now, cold therapy or cryotherapy is the use of any type of a medium where you are going to decrease the temperature of the tissues. And there are tons of devices out there like ice packs, cold packs. You can use just ice directly on the skin like an ice massage. There are cryotherapy units. All of these different types of devices that are really there to just accomplish the same goal, which is to decrease the temperature of the tissues. Now, cryotherapy is thought to work through this decrease in tissue temperature. This is supposed to decrease the amount of pain that people perceive, decrease swelling, decrease muscle spasms, and facilitate you getting back to doing exercise, mostly through the decrease in pain. This is why general guidelines indicate that cryotherapy can be useful for decreasing pain in acute injuries. Surprisingly though, despite its widespread clinical usage, the evidence supporting cryotherapy is mostly anecdotal. And the evidence that we have to support it is in post-surgical models. So think of things like when people get knee replacements or if they get ACL repairs or in acute ankle injuries. Not only that, but in some of these well-controlled trials, the results showing the effects of cryotherapy are less than spectacular. In one research study, Daniel et al. Looked at the effects of cold therapy on patients that underwent an ACL repair. And they stated that, quote, "In this study, we demonstrated that cold therapy decreased knee skin temperature. However, we demonstrated no benefit of cold therapy. There was no reduction in pain medication use or hospital stay. There was no reduction in limb swelling or increases in range of motion." Other results from different studies also suggest the same thing, and they state that results showed that ice pack therapy did not produce significant swelling reduction effect. On top of this, ice therapy is generally not used alone. Most commonly, it's used in conjunction with other things due to this acronym RICE. So generally, ice is used in conjunction with resting, compression, and elevation. And this makes it even more difficult to determine if the ice is actually giving the positive effect or if this effect is coming from the other modalities. So another research study looked at this and they said that generally, quote, "Generally, there was very little evidence to suggest that the addition of ice to compression has any significant effect." Another literature review looked at the effects of using ice on acute ankle sprains, and they stated that, quote, "Outside the immediate stages of injury management, cryotherapy may be most effective when combined with exercise. The adequate cooling can reduce their pain, spasm, and this neural inhibition, thereby allowing earlier and more aggressive exercise." Now, as stated, most of these studies were done in patients either post-op surgery where they got a total knee replacement or they got their ACL repaired, or in acute ankle injuries, But what about low back pain? Low back pain is an extremely common condition, and very commonly people use ice both in sports medicine, in chiropractic offices, in rehab offices, and then the general public. A lot of people are using ice to treat both acute and chronic low back pain. So Cochrane did a very large systematic review and literature review in 2006, and they stated that, quote, no randomized controlled trials were located that examined the effects of cold for low back pain. So where does this leave us? Is ice actually a useful therapy? According to the Association of Chartered Physiotherapists, there is, quote, moderate evidence that cryotherapy is effective at decreasing short pain after acute ankle injury or a soft tissue contusion. Now, pain is a very important consideration when we're talking about acute injuries. If patients are in pain, they are going to be either unable or unwilling to complete a rehabilitation program. And if they are in pain, they are going to be getting less sleep, and you need to sleep in order to actually heal the damaged tissues. Another literature review, Hubbard et al., they stated that, quote, when pain is effectively managed, the patient may be able to begin and progress rehabilitation sooner to address range of motion and strength deficits, as well as progress to full weight bearing and functional activities more rapidly. And this is what we want out of our patients. We want to do treatments that are going to allow them to get better faster, get back to full capacity, full range of motion as fast as possible without putting them in any type of a danger of re-injuring those tissues. But pain can be effectively managed through a number of different modalities, from electrical muscle stimulation or EMS to TENS units to topical medications like menthol and camphor, to manual therapies, to acupuncture. There are a number of different things that people can use to decrease their pain. And you can also use things like prescription medications when appropriate, like NSAIDs, Tylenol, or even opiates when they are clinically indicated. Personally, with my patients, I tend to avoid the use of ice because I want to allow the body's natural healing processes to occur. But I do want to decrease their pain and decrease their edema. So we use other therapies like topical creams that have menthol and camphor in them that will help to decrease their pain. We also use more passive strategies like using electrical muscle stimulation, TENS units, doing things like compression and elevation, and moving them on to doing more manual therapy and rehabilitation programs to get them better the fastest. The enemy following some type of an acute injury is not inflammation. Inflammation is a necessary part of the healing process. The thing that you want to avoid, or the thing that you are really trying to treat, is going to be the patient's pain and also excess swelling and edema that may happen. And these can be treated through a number of different modalities, as I described before. So I hope that this has been helpful. In summary, ice does have some evidence to support its use at decreasing pain. But this can be accomplished through a number of different modalities, including topical medications, including TENS units, EMS, manual therapy, and the like. And the literature just really does not back up the use of ice or cryotherapy in improving the time that it takes for patients to get back to their full capacity. Now, I want to point out that this video should not be construed as specific medical advice. If you have some type of an injury, I highly recommend that you actually seek out some type of a medical professional so that you can be adequately evaluated and they can create you a treatment plan to get you better faster. So again, this is Floyd Meyer reminding you to recover better so that you can do more.